Good morning, America. Today's topic is invest on Americans. Yes, investing on Americans. This may sound different, but policymakers out there in Washington, D.C., listen to this. We have been wasting trillions and trillions of dollars on healthcare. For the first time, we have an opportunity to invest on Americans. Let me explain to you how. This is an interesting topic to talk about. Abraham Lincoln said, this country can never be defeated from outside. This healthcare bill, what we are talking about today, is not a healthcare bill. It's all about freedom. It's all about freedom. Again, as Abraham Lincoln said, this country could never be invaded from outside. It will be if we falter on freedom. That's what it's all about. Today, we are spending, actually, 2018, we spent $3.7 trillion on healthcare. We still rank 37th in the world. That needs to change. It's not acceptable. We have got to be number one in healthcare delivery. How? You may ask me how. I'll explain to you how. We have employer subsidized healthcare, government subsidized healthcare like Medicaid, and state subsidized healthcare like Medicaid. All these dollars are going into the insurance companies, managed care companies, managed by few people. Invest the same money what you're investing in the insurance companies, folks. Invest in us. Invest in Americans. The reason I say that, we need insurance reform. We all know that we need insurance reform. It's policymakers have to, in Washington, D.C., irrespective of the party, Democrats, Republicans, invest in Americans, folks. Just invest that 3.7, what you're putting in healthcare, in Americans, on Americans. How? Okay, I'll tell you how. Medicare gives the money to mid-level agencies like managed care companies, or it gives that money to full risk contract takers. You know who these full risk contract takers are? There are a bunch of physicians all over the country. They have these full risk contracts. You know what they do? Very first thing they get the money. They're making millions and millions at the expense of ordinary Americans. You know what the first thing they do? They want to cut the corners. That's a mentality, human mentality, cut the corners. That money, invest in us. Why I say that? Give that money to the ordinary Americans. Why give it to few people, mid-level people? Why can't we invest the same money in Americans? If I get that same money, whatever, the $1,000 from Medicare or Medicaid or any insurance companies, you know what I would do? I would go, if there is an insurance reform, I will go and get High Deductible Health Plan, which will lower the premium. We need to make it mandatory to have insurance companies have this high deductible health plans according to the consumer's demand, not according to the government regulations. According to the consumer, have them give us the premiums basing on the consumer's demand. If suppose I can afford to have a $5,000 deductible, $10,000 deductible, If I have a health savings account, my premium will be way low because now I'm taking a risk on that 5,000 or 10,000. I'll, with a lower premium, whatever I'm saving, I'm going to put money, the same money which I'm saving, put money aside into the health savings account. Yes, it has to be regulated in such a way whenever your lower premium goes down, whatever you're saving, that money is mandated to go into the personal care accounts, health savings accounts. That basically you're investing in Americans where they're saving in personal care accounts or health savings accounts. Tomorrow, if the need arises, first thing is I have to use that money to get health care. I have to shop around where I can save. Instead of government giving money to the mid-level agency where they're trying to save, give the same money, invest in us, Americans. Americans know how to take care of their health. Americans know how to handle that. Americans know how to shop for health, save money on health. Believe me, folks, this is the solution for healthcare. Give that money back to us. Medicare full risk contracts. Don't invest in mid-level agencies to bureaucrats and their healthcare. Some of these doctors, managed care companies, insurance companies, they're investing on this insurance and few individuals. Why can't you invest in us? Give that money $1,000, $1,100, $1,200. I will take that money and buy a high deductible premium. Money saved from Medicare giving me that $1,000. My premium should be down, whatever it is. Money saved from that, I'm forced to put it into the savings account. Do you understand that, folks? It's a simple concept. Why can't these policymakers understand that? Medicare don't want to handle the funds from what we have contributed. Put that money back into the consumer's pocket where they will go and shop for a high deductible health plan where we can get lower premium catastrophic policy. If I'm putting that same premium into insurance companies where I will invest $400, whatever it is, and $400 for insurance and another $400 or $600 into my savings account according to my needs, not somebody else's needs. That's a common sense approach, guys. I can't emphasize that fact. I will keep harping on this policy over and over till somebody gets it. I'm so frustrated with policymakers in Washington, D.C., both Democrats and Republicans. It's a high time. We need an insurance reform. All the insurance companies have to just eradicate traditional policies. Make the insurance company respond to the consumers' demands. Insurance companies have to be consumer driven. Health insurance, like auto insurance, you get the deductible auto insurance, your premiums are lower. Make it like an auto insurance, folks. Make the government invest in all of us. When I'm in a blue collar worker, I'm have the employers participate in high deductible health plans. First deductible, high deductible plan, let the employers pay for it. But after that, all the employees will have health savings accounts. Make it a must. Forget about Obamacare. Forget about all this. Anytime the insurance companies or managed care companies, very first thing they do is cut down the corners, refuse to provide pre-existing illnesses, refuse to provide certain drugs, refuse to provide services because they're expensive. Give that control back to the Americans. They know how to save money because it's in their personal health savings accounts, like having a social security card. And today with the telehealth, everything is done on the mobile phone, online MD Live, Google MD Live, Microsoft MD Live, Amazon MD Live, Siri MD Live, Google. You can talk to your mobile phone and shop for the healthcare where the premiums are lower. Insurance companies also have to be consumer driven. Not only the healthcare, insurance companies have to be consumer driven, folks. We are forgetting. It has to be across the state lines, like auto insurance. Same thing in health industry. It has to be across the state. Wherever I can get low premium, consumer-driven premiums, I will save every penny on the insurance and get a policy which I can afford it. If America invest in Americans know how to handle the healthcare. We need freedom. This is how you get the freedom back. Consumer-driven healthcare, folks. I'll keep harping on this concept over and over till somebody gets it. I'm betting the President of the United States, Congress, Senate, they need to look into it. Invest in us. That same money you're wasting in healthcare and spending on billing agencies, billers. We don't need 9,000 billing companies, folks. We don't need billers. You pay as we go. Just pay as we receive the healthcare. Why do we need billers? Why do we need these CPT codes, DRG codes? You are sending these CPT, DRG codes across the globe for them to rip up Americans off. We need to stop that. We need to get rid of this CPT and DRG. We need to reform the Medicare as we know it. We all know Medicare is bureaucratic. It is inefficient. We are losing money in Medicare. It is not salvageable. Let's do it, folks. Let's reform Medicare. Let's have insurance reform, health insurance reform, which is a high time. If you like this channel, subscribe to this channel, hit the notification button. I'm still trying to go live so I can have a larger audience. I'll keep trying this. And please do make some comments. I would like to listen to people and get to know what their views are. It is very important for this to succeed. Thank you. Thanks again for joining us. We'll see you in the next episode of health insurance reform and whatever the different topics are.